cataract, congenital glaucoma, corneal ulcer, corneal scar, newborn conjunctivitis, and retinoblastoma are among the various eye diseases that, if not detected early, lead to blindness and, in some cases, death. This has been a major worry for health practitioners. Professor Vera Adobie-Suman is a lecturer at the University of Ghana Medical School and is also a children's eye specialist at the Korle Bu Teaching Hospital. She speaks to City News about such challenges.
But one of the conditions that we are even sad about, almost all the other conditions that we've spoken about, causes blindness as the ultimate. But the eye cancer in children that we call retinoblastoma, that's one, apart from causing blindness, can actually kill the children. And for that one, for instance, in the developed country, if you have about, let's say, 10 children, or let me put it, 100 children who develop this condition, hardly will you get about 3 of them dying. Between 1 to 3 may die from the condition. If it comes to our part of Africa, we are getting more than half of them dying.
Professor Vera Adobie-Suman further outlines some measures parents can adopt to detect and prevent deterioration of such conditions.
If the front part looks very big, bigger than what you are seeing now, you are not seeing the white on the side of it, the person should be sent. If you are not seeing the dark brownish thing very well, it's cloudy like it's about to rain or bluish, that child means that the pressure in the eye is likely to be high and it can cause irreversible blindness. That child should be sent to an eye specialist. If the white part is red and the child cannot tolerate light and all that, please send to the eye specialist.
In a bid to prevent cases from deteriorating before they are referred to teaching hospitals, the Rotary Club of Accra La East and Rotary Club of Detmold Bloomberg have thus acquired devices and have begun training of primary health care providers drawn from across the country, from particularly those in less resource health facilities, to help in detecting these diseases. Melvin Idrisu, a member of the Rotary Club of Accra La East, explains how his outfit is helping in preventing the mortality and blindness associated with these diseases.
Each nurse would be given a device, very simple device that she can charge with solar. So if she's in an area of the country where there's no electricity or there's a power outage, she can put it in the sun and charge it. Otherwise, she can just plug it up to her computer or to a power source and charge it up. When the children come to see her, she uses this to check the eyes, check their diseases and all of that.
Officials from the Ghana Health Service tell City News they are committed to addressing these challenges, as the cancer of the eye has now been captured under the National Health Insurance Scheme.
From 2015, as a country, we did the first national blindness survey, a study, and then we realized that as a country, our prevalence of blindness, if I say prevalence of blindness, how many people are blind within the population, we realized that it's 0.74%. And luckily, government has approved that retinoblastoma, which is one of the major childhood cancers, is part of the cancers that will come under health insurance.